Hi, my name's Zaina. I'm going to be your nurse today. I just have to ask you a few questions before we go ahead and get started with your routine checkup. Do you have any history of alcohol use?
I drink socially sometimes.
What would you say that socially means to you?
Like a beer, at a party.
Okay, and how often would you say that that happens?
Probably like once a week.
Okay. Do you have any history of drug use, illicit drug use?
No, not illegal stuff.
Okay. What about like smoking, cigarettes, or tobacco? Any tobacco products?
Yeah, I smoke.
Okay. How often would you say that you smoke?
Every day, probably about like 2 packs.
2 packs a day. Okay. Would you say that smoking that many cigarettes has started to affect your health in any way? Do you notice any other signs and symptoms?
I don't know if this is related to smoking, but I just got diagnosed with asthma. And also, I'm having a chronic cough and I'm having tons of like sinus problems and stuff.
Okay. Now, can you share with me if you have any family history of smoking?
My mom doesn't smoke, but my dad, he did. He died of lung cancer a couple years ago.
I'm sorry to hear that. Well, from what you've told me, it's concerning the amount of cigarettes that you smoke per day for your own health. I don't think that that's safe with your asthma, with your chronic coughing, with any of your other sinus problems as well. So is it okay if I gave you some advice, would you think?
I'm not really here for that, but if that's what you need to do, that's fine.
Okay, so you're not here for advice on the smoking. I understand that, but I do think that the cigarettes that you're consuming is an unhealthy amount, and I would ask you to consider cutting back. So, if that were an option, how ready would you say you were to take those steps?
Not very ready.
If you could put that on a scale of 1 to 10, what would you rate it?
So like 0 being not ready at all.
Yeah.
Okay, probably like 1.
A 1?
Yeah.
Okay, why would you say that you're not a higher score, like between an 8 and a 10?
I've been doing it for so long. So I started when I was 14, and so like I just don't really see the need to change now, and it's just I like doing it, so I don't want to stop.
Okay. Is it more of a social thing for you? Is it kind of in a social setting?
No, it more relaxes me. I have really bad depression that I'm finally now getting under control, so.
Okay, so it seems like you have some underlying emotions or some feelings that you're trying to help with the smoking.
Yeah.
I think one step would be separating those two things, separating like your depression from the smoking itself. I think one way that we can kind of get at this would be if you were to list off some pros and cons of continuing smoking, and then we will talk about the pros and cons of quitting smoking. So can you think of any for if you were to stay smoking?
Some pros would definitely be that it relaxes me. I'll have my escape. So that's always good, and it just distracts me. I like the having something to do and up to my mouth. I just like the taste too. Those are all the pros of it. For cons, let's see. I have this niece, my brother's kid, and I'm not allowed to smoke around her, so it's really hard for me because I can't hang out with her for longer than like an hour because then I have to go take another smoke break. So
yeah,
that's the con. I can't really hang out with family.
That must be really tough, especially since at this age you would want to be able to spend as much time with her as possible. How does it make you feel when you're hanging out with your niece and then you have to leave to go take a smoke break? Do you ever feel like upset or guilty about that and wish that sometimes that you didn't smoke because of that?
Yeah, sometimes I just feel upset about it that I have to leave her, and I don't want her to not like me, because family's important. I don't have much left.
Yeah, I definitely understand that. And you would want her to look at you as a good role model. You'd want her to look up to you and see you giving her healthy habits as well. Well, that's good that you were able to list pros and cons of continuing to smoke. Now, thinking about it in a similar way, if you were to stop smoking, what would your pros and cons be then?
To stop smoking, I guess I could then hang out with my niece more. So that'd be a big one. My health, I'm assuming, would probably get better. Because you said that the asthma could be
Yeah,
from the smoking.
they are most likely correlated to one another, and cutting down on the smoking would be able to increase your health and lower the risk of you developing cancer one day.
Yeah, and I mean, if my dad's lung cancer was associated with, you know, the smoking, then that I don't wanna die early like he did.
Right, definitely. I mean, that's such an avoidable thing, and if you have something like that to learn from as well, it can be a motivator to want to stop smoking. Can you think of any other pros besides being able to hang out with your niece and the preventing cancer of not smoking?
My clothes. People tell me like my clothes smell, so I guess that would be a good one. I mean I don't notice, and my teeth might get whiter, but
there we go. So overall, your hygiene would increase.
yeah.
You would feel cleaner as a person, and so I agree with all those points that you mentioned. Now, for you, what would be some cons and some setbacks as to why you would not want to stop smoking?
I mean I like it, you know, so that would be a con. I don't know what I'd do to calm myself down when I get nervous. Because you know, cigarettes, they're always there. You know, friends you can't really have to by your side 24/7, but you can have a pack of cigarettes right there for you.
Okay, I understand that. You know, there are some other things that can be done to like decrease your anxiety, which what it seems like you're having from is anxiety. When you're feeling that feeling of being alone or feeling like you have those bouts of depression coming about and the smoking calms you down, there are other ways that you can cope with that in the same way that wouldn't be as detrimental to your health, that could help alleviate some of the asthma, some of the coughing and sinus problems, and would lower your risk for cancer in the future as well. So how ready would you say now, after we've discussed these things, to change from a 1 to a 2 to maybe a different score?
Maybe like a 6.
Okay, a 6 would be an improvement. Now, I'm going to go ahead and make some suggestions. Would that be okay with you?
Yeah, that's fine.
Okay. Some suggestions would include, well, you can find some activities that would also keep you busy, that would make you less likely to want to smoke. And if you see that starting to improve, like your craving for it, that would be a good thing. But if that doesn't work, and I'm sure you've tried other activities too and hanging out with your friends, another thing we could try is nicotine patches, because some of that feeling that you're getting that the cigarettes are helping you with can be helped with that feeling as well, and it's not as detrimental to your health. And that's a kind of a longer way of getting off of this addiction. It'll take some time, but if you have the drive to want to quit for all of those reasons you told me that quitting would be good, then it would be a good option for you as well. And since it's kind of related to your depression and you just feeling down, like you said to me that cigarettes will always be there, but your friends won't always be there, there are other ways we can treat that with therapy and group sessions, and there's different support groups you can join for people who want to quit smoking and for people in general who just feel like they want to go about a more natural way other than medication for their anxiety and depression. So if those don't work, we can also look at medications for your depression too. But overall, I think it's great that you have moved from that 1 to a 6 on the readiness ruler. And I was wondering if you wanted to schedule a follow-up visit so we can talk about this some more.
Yeah, that'd be good. We can try to get some group or something. I mean, I don't know if I would just be able to quit right away, but at least cut down at first, probably.
Yeah, it's a step-by-step process. We can make goals that are attainable and reach them one day at a time.
Okay, yeah, that works.
Okay, so do you want to come in next week around the same time?
Yeah, that's fine.
All right. Well, I'm glad we got to have this talk. I'll see you next week.
All right, thanks.
No problem.